Welcome to the Old Dominion EMS Alliance video on BLS Glucagon administration. In this training, we're going to review the drug reference for glucagon available in the 2018 ODEMSA patient care protocols. Including in that, we're going to discuss the indications for glucagon administration, as well as we're going to go over the steps for preparing glucagon for injection. Glucagon is a naturally occurring pancreatic hormone. It is released by the pancreas to increase blood glucose levels. Glucagon works by stimulating the release of stored glucose in the liver. The indications for BLS providers are to give for suspected or confirmed cases of hypoglycemia. Oral glucose is the first-line treatment for hypoglycemia. However, glucagon can be administered if oral glucose administration is contraindicated in cases where the patient is unresponsive or unable to control their airway. The major contraindication for glucagon is known hypersensitivity to the medication. Use caution in patients with cardiac disease or coronary artery disease, as glucagon can have a sympathetic stimulation effect on the heart. Also geriatrics, patients that have malnutrition, alcoholics, hepatic disease, or renal insufficiency. The pregnancy is pregnancy class B. The dose for glucagon for BLS administration is 1 milligram IM. 1 milligram is going to be the full vial. Remember that BLS providers are not able to do med math, so they'll have to administer the entire vial. For pediatric patients that weigh 20 kilograms, which is 44 pounds, BLS providers can administer 1 milligram IM. Again, that is the full vial. There are other indications for glucagon. However, BLS providers should only administer glucagon for suspected or confirmed hypoglycemia. The onset is about 30 minutes for glucagon. If you've run with ALS providers and you've had hypoglycemic patients, you may have seen them give intravenous glucose and the patient wakes up pretty immediate. However, once you give glucagon, it may take several minutes for you to see any response to the medication, and that's completely normal with glucagon since it has an onset of 30 minutes. The duration is 1 to 2 hours. There are side effects, nausea, vomiting, and other rare side effects, angina, urticaria, and dizziness. It can interact with beta blockers, so be sure to monitor your patient's vital signs and blood pressure if the patient is taking those medications. Some things to consider when administering glucagon. Glucagon only works when there are normal liver stores of glycogen. It will not work in patients with chronic hypoglycemia, malnutrition, or starvation. It also may not work in patients with chronic alcoholism for similar reasons, including hepatic disease. First-line treatment for hypoglycemia is always glucose. Use glucagon as a last resort in insulin-dependent diabetics, as they will already have depleted stores of glycogen. Glucagon will deplete glycogen stores further, and it takes some time for the stores to regenerate. Any patient receiving glucagon should be transported to an appropriate medical facility to be monitored for refractory hypoglycemia. Preparing glucagon for administration. First step is to prepare your equipment. Have the glucagon package, alcohol prep pad, and we recommend a 3 ml syringe. A 1 ml syringe will also work, and we recommend a 21 gauge needle, which is usually the green hub, is what we recommend. Open the package and pop off the tops for both vials. Open the syringe. If need be, screw on the needle. Insert the needle into the vial of sterile water and carefully draw up the entire volume, which is 1 milliliter. You should invert the vial, and you may need to retract the needle slightly to ensure that all the fluid is drawn up. Next, insert the needle into the glucagon vial with the powder. Slowly inject the fluid into the vial. Now keep the needle in the vial and mix the powder with the water. Do not shake vigorously, but you'll want to swirl the contents until they're mixed. Just know that shaking or vigorously mixing can cause bubbles to form, which will make it hard to draw up the medication. Next, invert the vial and withdraw the needle slightly so that all the contents can be withdrawn. Draw up all the contents from the vial, which is approximately 1 milliliter. Removing the needle from the vial, it's helpful to draw a small bit of air. Knock out any air in the fluid and inject the air until the fluid starts coming out of the tip of the needle. Agencies should provide additional hands-on training in mixing and giving IM injections before you would be allowed to give glucagon injections. BLS providers are not authorized to administer glucagon unless specifically authorized by their OMD. Any questions, please contact the ODEMSA Training Director, Megan Young, at the number or email on the screen.